When I first met Oscar with Patty in November 2023, that was the first time I realized that I had met about 200 Oscars previously, but I didn't know that the cause was jaundice, an ailment that 60% of normal children develop and get over, and 80% of premature children develop, and it's more dangerous. And if it's not detected and if it's not treated by a simple light box, it can give you lifelong, debilitating and even deadly conditions. It became a compulsion to do something about it.
So what we did with Project Oscar is we worked with the Andersons and the Ministry of Health, and we provided light boxes to all the rural hospitals in Vietnam, and then did a training course for the nurses and the healthcare professionals such that they understood how to diagnose neonatal jaundice, such that we could have a significant impact in terms of reducing the incidence of undetected, as Oscar says, one of the most underreported diseases with devastating consequences.
We took courage from the fact that Reckitt had done this in Vietnam. So we got together, and we're not starting the program from scratch. We're using existing evidence, existing research, and most excitingly, new tools that can actually photograph the skin of a newborn of colour and tell us whether it looks like jaundice. We're measuring that against the old serum bilirubin tests, and we're taking an entire state in Nigeria, inspired by Oscar. We are training 10,000 mothers in the first phase. We're going to screen over 9,000 infants in the first phase. We actually started in April with the pre-learning work. We've chosen 300 healthcare workers who will be trained in recognizing the signs and symptoms of neonatal jaundice and also treating it promptly. We've selected 6 tertiary healthcare facilities, teaching hospitals, and they will be equipped with phototherapy machines from the program and billy strips and the blood tests. And we're also extending right from day one to primary healthcare facilities, because that's where the problems present. Now, my aim as we light up Nigeria, starting with Lagos State, inspired by Oscar. And I know I'm very tearful because, I've been a mother of premature babies myself, and meeting Oscar, when you come from a country where parents hide disabled children, was the compulsion to remove that hiding and make this work. But if we can interrupt the cycle of neonatal jaundice and kernicterus that leads to cerebral palsy and long-standing brain damage within day 3 and day 8. And if we can move the WHO to a policy of providing every hospital with a light box, and if we can move the practice of medical facilities to testing every child before discharge, we can actually prevent this disability. And for those that have the disability, as you can see, Oscar is very coherent. He knows what he wants. He's the inspiration behind this. I'd also like to give a shout out for disability rights, where people with disabilities have to be respected. Their autonomy and their being their own agents of transformation also has to be recognized.
I was born in Saigon in Vietnam, according to my parents' name. I was incredibly jaundiced after 10 days, and they took me back to the hospital, and the doctors didn't know what was wrong with me, and my parents basically were on a hospital tour of Vietnam, of Saigon, It's sadly it's one of the most underreported conditions in the world. And basically the main goal of Project Oscar is to stop whatever happened to me happening to others.
Oscar and his advocacy and his determination to use his voice and to be heard. I am merely the voice box for Oscar. And it's only through his inspiration and through the great partnership. I tell Toyin all the time that I never would try something in Nigeria without somebody like Toyin, because I'll tell you what, nothing's going to get in her way.
It's all about Oscar and the ultimate gift that Oscar has given the hundreds and thousands and millions of Nigerian children who will be born with jaundice or develop jaundice in the first week of life, and for whom we will interrupt that jaundice and stop it from being kernicterus as he's given himself. So from my philanthropic effort, it's to put the partners together, the private sector, the government, the researchers, the equipment manufacturers. But I want to say thank you to Oscar. I promised him the first time we met that what happened to him, I would work with him to make sure it didn't happen to Nigerian children.